Gentlemen, let's talk about a question almost every man has wondered at some point, but rarely asks out loud. Is it really possible to increase penile length in a world filled with bold claims, miracle products, and unrealistic comparisons? The truth often gets buried beneath layers of misinformation and insecurity. Many men silently carry doubts about their bodies, believing something is wrong with them, when in reality, most are perfectly normal. This video isn't about myths or marketing, it's about science, facts, and truth. Because here's the reality. Confidence doesn't come from chasing illusions, it comes from understanding how your body truly works. Science has advanced, and we now know what methods actually make a difference and what is nothing more than a sales pitch. From medically approved traction devices to lifestyle changes that improve blood flow and hormone balance, real solutions do exist, but they require knowledge, patience, and discipline, not desperation. In this video, we'll break down what science says about penile growth, what's proven, what's dangerous, and what truly enhances not just size, but performance, confidence, and vitality. This isn't just about physical enhancement. It's about reclaiming control over your health and mindset. So if you've ever doubted yourself, compared yourself to others, or wondered whether real improvement is possible, stay with me till the very end. You're about to learn that when science meets self-awareness, transformation is not only possible, it's within your reach. One of the most common insecurities men face, regardless of age or background, is concern about penile size. This anxiety often stems from misinformation, unrealistic portrayals in media, and a lack of proper sexual education. Before exploring any methods of enlargement, it's essential to begin with an understanding of what is actually normal. Scientific studies involving thousands of men worldwide have consistently shown that the average erect penile length falls between 5 and 6 inches, with a circumference of about 4.5 to 5 inches. This means that the vast majority of men already fall within the healthy, functional range, even if perception sometimes says otherwise. The problem isn't always the body, it's the comparison. Society's unrealistic depictions, particularly through pornography, have shaped expectations that do not align with biological reality. This false standard has led many men to view themselves as inadequate when, in truth, they are completely normal. Understanding anatomy helps separate fact from illusion. The visible portion of the penis is only part of the structure. A section of it extends inside the body, attached by a ligament known as the suspensory ligament. This internal section plays a vital role in erection stability and sexual function. The variation in external length is largely due to genetic and hormonal factors during development, not lifestyle or behavior in adulthood. Studies also show that there is little to no correlation between body size, hand size, or foot size and penile length, though these myths continue to circulate. The first scientifically proven step toward confidence in this area is accepting biological diversity as natural rather than viewing it as a deficiency. It's also worth understanding that the way a penis looks in its flaccid state is not predictive of its erect size. Some men appear smaller when soft, but experience more significant expansion upon arousal, while others maintain a more consistent size. These differences are completely normal and have no bearing on sexual performance or satisfaction. In fact, many partners report that confidence, arousal, and emotional connection matter far more than size. A man who understands his body, takes care of his health, and communicates well with his partner tends to have more fulfilling sexual experiences than someone chasing physical perfection. The psychological impact of misunderstanding size averages can be profound. Men who internalize these insecurities may experience performance anxiety, lower self-esteem, and even erectile difficulties caused by stress rather than physiology. Medical experts emphasize that addressing these mental barriers through education and counseling is often far more effective than pursuing risky or unproven enlargement methods. Confidence grounded in knowledge is more powerful than any external alteration. When a man learns that he already falls within the healthy and functional range, it creates a shift in mindset. It replaces insecurity with empowerment, fear with understanding, and comparison with self-acceptance. The goal is not to measure up to others, but to measure your health, satisfaction, and confidence by realistic, scientific standards. Once that foundation is built, any decision to pursue enhancement becomes informed, balanced, and guided by genuine self-awareness rather than misplaced pressure or illusion. Among all the non-surgical methods studied for penile enhancement, traction therapy stands out as one of the few approaches supported by scientific evidence. This method is based on a principle that has been used for centuries in medicine, the concept of tissue expansion. Just as orthodontic braces can gradually move teeth or medical expanders can stretch skin before reconstructive surgery, traction devices gently and consistently apply tension to the penis, stimulating tissue adaptation and growth over time. The process doesn't involve drugs or hormones. Instead, it relies on the body's natural ability to respond to gentle, sustained mechanical stress. When the penile tissue is stretched gradually and safely, it undergoes a process called mechanotransduction, where cells respond by dividing and multiplying to accommodate the new tension, leading to minor but measurable length changes over months of consistent use. Clinical studies conducted over the past decade have shown that medically approved traction devices, when used under professional supervision, can produce an increase in length ranging from half an inch to about 1 inch after several months of regular use, typically around 3 to 6 hours per day. The results vary depending on consistency, duration, and individual anatomy. Importantly, these outcomes are not instant and require patience and discipline. Men who follow proper guidelines and avoid excessive tension tend to see gradual, safe improvements without compromising sensitivity or function. However, those who use non-medical or unverified devices or apply excessive pressure can risk nerve irritation, bruising, or vascular injury, which highlights the importance of professional consultation before beginning. One of the key benefits of traction therapy is that it is non-invasive and reversible. Unlike surgery, there is no cutting or alteration of tissue structure, which makes it a safer option for men who are medically stable and motivated to try a conservative approach. Some doctors even recommend traction as part of recovery after certain penile surgeries, such as curvature correction, because it helps maintain tissue elasticity and length. When done correctly, it can also improve overall blood flow and penile health, since the stretching encourages better circulation in the region. It's essential, though, for men to set realistic expectations. Traction therapy is not a miracle solution, and it does not dramatically change anatomy overnight. Its purpose is to provide modest, medically verified results that enhance confidence and comfort. Combined with proper nutrition, hydration, and hormone balance, the effects can be more noticeable and long-lasting. The true value of traction therapy lies not only in its physical outcome, but also in the psychological benefits of taking a scientific and disciplined approach to improvement rather than turning to dangerous shortcuts. For older men or those dealing with loss of tissue elasticity due to inactivity or hormonal decline, traction therapy can help maintain penile health and prevent shrinkage associated with reduced blood flow. It reminds men that improvement is possible through patience, persistence, and medical guidance. In a world full of exaggerated claims and unsafe products, traction therapy stands as a quiet but proven example of how science, patience, and proper education can work together to create real, measurable results for men seeking improvement. When it comes to surgical or injectable methods of penile enhancement, it's vital to separate science from marketing and medical truth from online exaggeration. Surgery to increase penile size does exist, but it is not as simple or risk-free as it may sound. The most common surgical approach for lengthening involves cutting the suspensory ligament that anchors the penis to the pubic bone. This ligament is what helps the penis rise during erection, giving it stability and angle. By partially releasing it, a portion of the internal shaft becomes more externally visible, giving the appearance of added length when flaccid. However, the key word here is appearance. The functional length during erection does not significantly increase, and in some cases, the angle of the erection may change, causing the penis to point downward instead of outward. This can affect both aesthetics and sexual performance, which is why most urologists only consider this procedure for specific medical cases, not for cosmetic purposes. Injectable procedures, on the other hand, are mainly designed to enhance girth rather than length. Fat grafting, dermal fillers, and even stem cell-based injections have been tried, with varying levels of success and safety. Fat injections involve taking fat from another part of the body, purifying it, and inject it beneath the pineal skin. While it can increase circumference, fat can sometimes reabsorb unevenly, leading to lumps, asymmetry, or firmness that doesn't feel natural. High hyaluronic acid-based fillers, similar to those used in facial aesthetics, are also used to increase thickness, and when done correctly by a qualified professional, they can produce a smoother and more even appearance. However, they are temporary and may need repeat treatments every 12 to 18 months. There are also reports of complications such as inflammation, infection, or damage to blood vessels if performed by untrained hands or using unapproved materials. The critical factor in both surgery and injections is medical supervision and realistic expectations. These interventions are not meant for men who are within the normal size range, but feel inadequate due to comparison or anxiety. They are reserved for those with genuine medical conditions such as micropenis, Peyronie's disease, or severe psychological distress after proper counseling and assessment. Every procedure comes with trade-offs. Surgery carries risks of scarring, altered sensation, or changes in erectile mechanics, while injections carry the possibility of uneven results and need for maintenance. What often surprises many patients is that after such procedures, psychological satisfaction doesn't always match physical change. Studies have shown that men who undergo surgery for cosmetic reasons sometimes continue to feel dissatisfied, not because of the results, but because the root of their insecurity lies deeper in self-image rather than physical measurement. A responsible urologist focuses not just on altering anatomy, but on helping men understand their motivations and ensuring that their decision is safe, informed, and necessary. True medical practice values function over form, safety over speed, and knowledge over impulse. Surgical and injectable procedures can produce measurable changes under the right conditions, but they should never replace education, emotional health, or healthy lifestyle choices that naturally support sexual function and confidence. When discussing enhancement or improvement of penile size and function, one of the most overlooked yet powerful factors is overall lifestyle and health optimization. The penis is not an isolated organ. It reflects the state of your cardiovascular system, hormones, and metabolic health. Blood flow, nerve sensitivity, and tissue elasticity are all influenced by how well your body functions as a whole. This is why many men who adopt healthier lifestyles, losing excess weight, exercising regularly, managing stress, and balancing their hormones, notice natural improvements in not just their sexual performance, but also in the appearance and function of their penis. Good health enhances confidence, circulation, and hormonal balance, all of which play a direct role in how full, firm, and responsive erections appear. The most critical foundation of male sexual health is cardiovascular health. The arteries that supply blood to the penis are much smaller than those in the heart, meaning they can be the first to show signs of reduced blood flow due to cholesterol buildup, diabetes, or hypertension. When blood circulation weakens, erections can appear smaller or less firm, creating the illusion of reduced length or girth. Regular aerobic exercise such as walking, swimming, or cycling helps keep blood vessels open and flexible, improving oxygen delivery to all tissues, including the penis. Resistance training and strength exercises also boost testosterone levels naturally, which supports better libido and overall energy. Even modest lifestyle changes, such as reducing smoking, limiting alcohol, and eating healthy foods, and can make a measurable difference in erectile quality and the visual fullness of the penis. Hormonal balance is another critical element, and testosterone plays a key role in maintaining tissue health, sexual desire, and overall energy levels. Low testosterone can cause fatigue, loss of muscle mass, and decreased sexual response. Men over 40 often experience a gradual decline in this hormone, but through proper nutrition, weight management, stress reduction, and medical evaluation, testosterone levels can be supported naturally. Consuming foods rich in zinc, vitamin D, magnesium, and omega-3 fatty acids helps promote hormone production and blood flow. Staying hydrated and getting quality sleep also optimize testosterone levels and improve the body's repair processes, both of which contribute to better erectile health and perceived size. Equally important is the psychological dimension. Stress, anxiety, And depression can cause hormonal disruptions and restrict blood flow through tension and elevated cortisol levels. Practicing mindfulness, meditation, or relaxation exercises helps calm the nervous system, enhancing both physical and emotional intimacy. Confidence and emotional well-being are inseparable from sexual function. When a man feels balanced and strong mentally, his body often reflects that stability through better arousal and performance. For men looking to improve their penile length or performance, the real transformation begins not with external devices or procedures, but with internal health. When blood vessels are clear, hormones balanced, and the body's strong, erections are firmer, endurance is greater, and satisfaction is deeper. The natural result is a penis that functions at its best capacity, appearing more vital, energetic, and confident. Science shows that lasting improvement doesn't come from shortcuts. It comes from discipline, health, and the decision to treat your body as a system that thrives on balance, strength, and care. In conclusion, when it comes to increasing penile length or improving sexual performance, the most powerful tool a man can have is knowledge. There is no magic pill, no secret supplement, and no instant solution that safely transforms your body overnight. What science truly supports are informed, measured, and medically guided approaches. Understanding what's normal helps free men from unnecessary shame and comparison. This evidence-based traction therapy offers gradual, real results when used responsibly. Surgical and injectable options can bring changes, but should only be considered after serious consultation, understanding the risks, and focusing on safety above all. And perhaps most importantly, lifestyle and health optimization remain the foundation for every aspect of sexual wellness, because a strong heart, balanced hormones, and a confident mind are what truly sustain a man's vitality. This topic is not about vanity, it's about education and empowerment. When men learn how their bodies actually work, they stop chasing myths and start taking control of their health. The truth is, improving sexual confidence is less about inches and more about understanding, function, and self-respect. So science doesn't promise miracles. It offers results built on patience, discipline, and consistency. Every improvement you make in your physical and emotional health contributes far more to your sexual well-being than any shortcut ever could, sis. So to every man watching, remember that your worth and strength are not measured by size, but by how you care for yourself, how you treat your body, and how you educate your mind. Take your health seriously, seek professional advice before making decisions, and never let misinformation dictate how you see yourself. True confidence is built on truth, not comparison. Sis, thank you for being part of this important conversation. Your curiosity and openness to learn already put you ahead on the path toward better health and self-awareness. Keep striving to understand your body, nurture it, and treat it with respect. I wish you confidence, clarity, and lasting well-being in your journey toward a healthier, stronger you. Good luck, and thank you for watching.